So I'd now like to hand over to our next speaker, Dr. Ben Smith. Over to you, Ben.
Thanks, Vanessa. And thanks for having me along to talk to everybody about fear of cancer recurrence and what we can learn from the latest research. Maria and I have actually worked together on some studies to try and help people manage their fear of cancer recurrence. So there will be a little bit of overlap between our presentations. So I apologise for that, but hopefully, although I managed to be quite boring, inelegant, and untidy in helping me reduce my stress in real life, that'll be less of the case today. But, so Maria has already run through what fear of cancer recurrence is. So I won't go into the definitions, but one thing I do want to emphasize is that fear of cancer recurrence is a very normal experience for anybody affected by cancer. We know from a big review of more than 100 studies that have happened on this topic that at least half of people experience moderate to high levels of fear of cancer recurrence that are likely to cause distress and have an impact on their daily life. So this is a very common phenomenon. So if you're experiencing fear of cancer recurrence, please don't feel like you're the only one. It's a very normal thing to have after cancer. Having a little bit of a problem with the slides, but here we go. So that previous chart that I showed you was of fear of cancer recurrence, people affected by cancer generally. This one pertains to fear of cancer recurrence in women who have had ovarian cancer in particular. So it's estimated that anywhere between 1 in 5 and 4 in 5 women who have had ovarian cancer experience fear of cancer recurrence. And the reason why there's such a big range of estimates there is because there's different ways we measure fear of cancer recurrence. But I think this chart is quite useful in showing how often people think about this. You can see that these are people who have been cancer-free for about 7 years, and there are a reasonable portion of people, about a third, who do think about cancer coming back very little, which is great. But we then see that even 7 years post having their cancer, there are still about a quarter of people who are thinking about their cancer coming back weekly, and about 10% for whom it's a daily concern. I think another important point to make is that fear of cancer recurrence doesn't just affect the person directly affected by cancer. It's very common in caregivers as well, and some studies have shown that it's actually more common in caregivers, perhaps because carers are a bit reluctant to express their concerns to the person directly affected by cancer. So if there are any carers tuning in today, I hope that you feel that, that some degree of acknowledgement that this can be an issue for you too. And Ovarian Cancer Australia actually has some resources specifically for carers. And this is an example of a webinar that was put in pertaining to carers a couple of years ago. So I think it's often assumed that fear of cancer recurrence will reduce over time, that as people move on from finishing treatment, their concerns about their cancer coming back will reduce. But what we actually know from the literature is that fear of cancer recurrence left untreated or unmanaged is very common continues over time. So you can see from this study, which included about more than 100 gynecological cancer survivors, more than half of whom were ovarian cancer survivors, there's this group of about half of those women who are experiencing high and stable levels of fear of cancer. We know that in this group, they're more likely to be women who are Caucasian and have advanced disease, and that heightened fear is associated with increased levels of depression and cancer distress, but it's also worryingly associated with lower people expressing their concerns to others less, and having a lower amount of degree of self-efficacy to or belief in their ability to cope with managing those concerns. I think this is really worrying, because if you don't think you can cope yourself with your concerns, but you're also not expressing them to other people to try and get support, then you're likely to suffer from much worse outcomes. So I'd encourage anybody who's struggling with these concerns to, what we can learn from this is sharing your concerns with people is better, and that's particularly important if you don't think you're able to manage them on your own. So we know there are a few other risk factors for fear of cancer recurrence. It seems like in women with ovarian cancer in particular, the time around finishing active treatment is, and what I mean by that is well, most commonly chemotherapy, I guess, and also the time when you're coming up to follow-up tests or appointments. That's a really stressful time as well. In people with cancer generally, Maria's already covered some of this, but people who are younger experience physical symptoms. They're generally anxious, are also more likely to experience fear of cancer. So I think when it comes to finishing active treatment, as Maria said, I think there's a lot of, people often assume that that's a great time. People are finished their treatment, they can move on now, their cancer they've dealt with their cancer, but a lot of people actually find this a really scary time because they're not doing anything to actively fight it, as shown by this quote. So, it's really important to know that this is a common experience, and I'll give a few tips on how to deal with it a bit later. And again, with follow-up tests and appointments, another really stressful time where people are very anxious leading up to their appointment. And again, I'll run through a few tips to manage that. So, in terms of managing those fears that tend to pop up before having follow-up tests or appointments, as Maria said, I think it's important not to beat yourself up too much, and although beliefs about worry can negatively impact or exacerbate fear of cancer recurrence, I think in the short term, in these particularly stressful time periods like before follow-up appointments, it's okay to worry. Don't beat yourself up about it. And as Maria said, there is really very weak evidence or a lot more studies showing no link between stress and cancer than there are studies showing a link. It might help if you help to plan something nice in the days leading up to your appointment, just to take your mind off things a bit, and also share your concerns with others. As I said, there's evidence that if you don't share your concerns, you're actually more likely to have high fear of cancer recurrence. So share it with your friends and family, trusted loved ones, and that'll help reduce that burden. You can also use techniques that Maria alluded to, like thinking about those worries as like passing clouds in the sky, or trains at a station that you don't have to engage with and you can just let pass by. But if you do continue to worry about your cancer coming back after your appointment, it's probably a good idea to go and seek some professional help. So it's really important that we address fear of cancer recurrence, because in addition to the fear itself, it's also associated with a lot of really horrible outcomes, like even symptoms that are a bit similar to post-traumatic stress disorder, and a general sense of hopelessness. So it's important that we address this concern, and I'll talk a little bit about what has been done to try and manage fear of cancer recurrence. So before I do that, this is just reiterating that fears about cancer coming back are really common in women with ovarian cancer in particular. And if we think of you can see here in this study where there were 50 women included, 30 or more, their top concern was fears about the cancer coming back. And about 50% of those are experiencing high levels of stress associated with that concern and wanting more help to deal with it. So what treatments are there for fear of cancer recurrence and ovarian cancer? Well, to date, there's only been one study that's looked at a treatment for fear of cancer. Well, a treatment that has addressed fear of cancer recurrence to some degree. It's not really specifically focused on it. And I'm just going to talk through this study now. So it included 352 women with gynecological cancer, almost 2/3 of whom had ovarian cancer, and they were recruited less than 6 months post-diagnosis, so fairly close to their experience with diagnosis. And so the main intervention that these investigators were testing was an intervention that aimed to teach people coping skills and communication skills. So really teaching a lot of the strategies that Maria has mentioned, and also helping them communicate with both the healthcare team and their friends and family. Consisted of 8 sessions, only one of which was really focused on fear of cancer recurrence specifically. I mean, it was really an intervention aimed at addressing psychological concerns in ovarian cancer, women with ovarian cancer generally. There was also, so there were actually 3 arms to this. The second arm was a supportive counselling intervention where people had time with a psychologist, but they weren't taught any active coping skills. Instead, the psychologist was directed just to provide empathy and support. And then there was a usual care arm where people got the standard kind of consultations with a social worker, and then also were referred to the psychologist. And the treatment seemed to be pretty well accepted by patients, with more than 80% attending all sessions. And here are the results. Apologies that the graphs are a little bit hard to read, but this is showing a number of different outcomes. Fear of cancer recurrence is down here, and I'll talk about that in more detail in a second. But the solid line here represents the coping and communication skills training. And this is looking at, so you can see that over time, out to 18 months, there was a significant decrease in depression. And then there's also a drop in distress, and this is emotional well-being here. So there's a small rise in emotional well-being, but when we look at the fear of cancer recurrence outcome, so it's just enlarged here, what you see is after an initial drop out to 6 months, it actually increases a bit, again, back to the same kind of level we saw in the beginning. And this drop is actually very small. The graph here. So there was no real, unfortunately, this intervention didn't really impact on fear of cancer recurrence. And interestingly, there was no association seen between fear of cancer recurrence and problem-solving coping. So it suggests that fear of cancer recurrence isn't necessarily an issue that can just be problem-solved away. It's not. I mean, because it is possible for some people that cancer will come back. It's not something where we can just say, don't worry about that. So I'm going to talk a little bit more now about the treatment that we've come up with for fear of cancer recurrence, which is called Conquer Fear. And the difference, I suppose, between this treatment and some of the others that have been trialled is that it's not aiming to get rid of or eliminate fear of cancer recurrence. It's actually trying to help people live better with that concern. And I'll just talk through the model briefly, but on the left-hand side here, this is, I suppose, the experience that many people go through after cancer. The diagnosis and treatment is a very stressful and distressing experience. That causes people to experience a stress response, which might consist of intrusive thoughts about the cancer coming back, or a lot self-checking for the signs that the cancer might be coming back. But over time, a lot of people do manage to establish a new kind of normal or sense of normality. But it's the people who have unhelpful beliefs about worry who we think are most likely to develop higher levels of fear of cancer. So those beliefs might take the form of positive beliefs about worry. So thinking that if they worry a lot about the cancer, that they'll be more prepared if they have a recurrence. Or there could be negative beliefs about the danger or uncontrollability of worry. As Maria said, thinking that their worry might actually cause a recurrence of the cancer. So what this causes is a really heightened perception of threat and also a lot of self-focused attention. This is what leads to things like the misinterpretation of symptoms as being signs of the cancer coming back. And this can cause heightened fear of cancer recurrence, which causes people to worry more, to check more, and that increased worry leads them to be either wallow in their worry or struggle against it, which then causes even more focus on the fear itself. So because so the conquer fear treatment aims to try and help people challenge those worries about their worry and also direct less attention towards the cancer. These are just a couple of the skills that are taught. I won't go into them in detail, but basically, as I said, the main tenet of the therapy is to try and help people live better with their cancer, live a life that's more consistent with their values and less focused on worries about their cancer coming back. So these are the kind of headline results from the study. So the Conquer Fear intervention was compared with a relaxation training group, which was called Taking It Easy. So that's this top line here. Along this graph shows the fear of cancer recurrence level. So you can see that both groups, the relaxation training and the Conquer Fear intervention, improved over time, but that the reductions in fear of cancer recurrence were much greater in the Conquer Fear group, which suggests that it's a really effective intervention. So unfortunately, so the Conquer Fear intervention consisted of 5 sessions delivered by a trained, highly skilled therapist, but unfortunately not everybody has access to those people. They're typically based at large metropolitan cancer centres, so people living in more rural areas wouldn't have access, for example. And there's also a lot of people who prefer to manage on their own. So we're currently working on an online adaptation of face-to-face Conquer Fear to try and increase access to fear of cancer recurrence treatment. Unfortunately, it's not currently designed for ovarian cancer sufferers in particular, but we are actually applying for a grant to adapt it for women with ovarian cancer. So perhaps in a year's time, if we're lucky, that'll be a resource that's available for ovarian cancer. And just in the meantime, though, the Ovarian Cancer Australia is developing a fear of cancer information sheet, which I'm very happy to be contributing to, and that will complement the resources that OCA already has, such as the Resilience Kit, which can help you manage some of these. Finally, I'd just like to thank everyone who's contributed to the work that I've just described, and thanks to Ovarian Cancer Australia for having me to talk to all the rest of you. And there's just a few references to finish if anybody wants to read more about it. Thanks.
Thank you very much, Dr. Smith, for that unbelievable presentation. Really, really valuable. There's just a couple of questions that have popped up. One is, why do you think there's no difference between women or people with early stage versus advanced stage cancer in terms of their levels of fear of cancer recurrence?
Yeah, I think that even though I suppose the objective risk of a recurrence is higher for more advanced disease. What seems to be more important when it comes to fear of cancer recurrence is a person's subjective perception of that risk. Ultimately, we're still not certain which people, or we're not very good at predicting which people will experience recurrence. So, someone who's got only a 1 in 4 chance of experiencing recurrence might worry about it just as much as someone who's got a 1 in 2 chance, just because they see that as an increase, or their perception of that risk is that that's a high risk. So I think it's we can't. We should be, or we shouldn't assume that people with early stage disease don't have these concerns. I think it's really important that we look out for people with these concerns, irrespective of what stage.
Sure, thank you. I'm just reading another question. It's quite a long one. Basically, this lady's saying that she thinks about cancer every day. She can't help but not, but her oncologist tells her not to. So she's asking, is it unhealthy to think about cancer so often?
So as Maria said, I mean, obviously that's something which I imagine causes this person a lot of psychological distress, and so I suggest that she should perhaps talk to a psychologist about it. But it's not something that will increase the likelihood of her cancer coming back, or is bad for her physical well-being anyway. But it might be worth, due to the psychological distress that causes, talking to a professional about it. But it is, I mean, look, it's really, as she said, it's really hard not to. She shouldn't beat herself up about it.
Sure. There are a few questions coming through. Was it time for just one more? How much time do you think must pass before fear of cancer recurrence decreases or goes away?
Well, I don't think there's, I mean, I suppose a lot of people, or some people, find it that over time their fears will reduce, and for a lot of people it's when they hit that 5-year mark. But there's not really a point at which we can say, oh, you shouldn't be worried about your cancer coming back anymore. So I think, and there's a lot of studies of people, 10 or more years post-treatment who are still experiencing concern. And I don't think that, we should be saying those people are time to stop now. The reality is that if you're still experiencing concerns at that point, there are probably, you should be thinking about some of the, or maybe try some of the strategies that have been mentioned today, or see someone about it. But it's okay to still have those.
Great, thank you. And I'll just ask one more if you've got time, if that's okay. Do you think the lack of information about what causes ovarian cancer increases the likelihood of people experiencing this fear of recurrence?
Yeah, I think there's definitely a link there. Some of the other work that I've done has been in testicular cancer, and helping men faced by that disease. And we see a similar story, that they, and I suppose those men are fortunate they have a better prognosis, and a lot of women with ovarian cancer, but they still worry about the cancer coming back, even though that's very unlikely, because they kind of feel, well, if I was unlucky enough to get the cancer in the first place and I have no idea why, what's to stop it from coming back? So I think, yeah, that does really feed into the cancer coming back. Yeah.
Thank you. We'll leave the questions there. Thank you so much, Dr. Smith, for your time. We really, really appreciate it.